So it's no news that fertility treatments are expensive. The average IVF cycle in the UK is between £6,000 to £8,000, and this is excluding fees for consultation, diagnostics, embryo storage, some medications, and even add-ons. Most people will have to pay for this out of pocket through private fertility care, and this puts a huge financial strain on couples. In practice, I've seen people sell off assets to try and afford even a cycle of IVF, selling off their cars, land, animals, and even their houses to try and afford one cycle of IVF. And unfortunately, the fact that people require multiple cycles of treatment before being successful increases that financial burden. Now, of course, when these treatments are successful, it is well worth it. Now, in the UK, apart from privately funded care, there's also NHS-funded care. Now, for NHS-funded care, what is offered varies widely depending on what the CCG, which is the Clinical Commissioning Group, decides in that region. So for whatever area you're in, you're going to need to know a couple of things. Number one, whether or not they actually fund any treatment at all. And if they fund any treatment, what kind of treatment do they fund and how many cycles of that treatment will you be eligible for? Any eligibility criteria they have for those treatments. Even though there are variations across different regions of the UK, I'm going to discuss a couple of eligibility criteria that are generally uniform across the UK. Some of these criteria are what I call modifiable criteria, which are things that you can work on to try and improve your eligibility, while others are non-modifiable because they are things that you can't really do anything about. The first criteria is the age, and usually women less than 40 are eligible for NHS-funded treatment. However, some regions have increased this to about 43 years of age. The difference between these two groups is usually in the number of cycles they're eligible for. So, for instance, in East London, where I practice, women who are less than 40 are eligible for 3 cycles of IVF, while women who are between the ages of 40 and 42 are only eligible for 1 cycle of IVF. The next eligibility criteria has to do with the duration that the couple have been trying to conceive for. Generally, you are only eligible for NHS-funded treatment if you have been trying for up to 2 years. However, there are exceptions. There's some people who would get treatment earlier, like people who have confirmed male factor infertility or those who have both fallopian tubes blocked. Another eligibility criteria has to do with previous children. Couples who have had children either in previous relationships or in current relationships are unlikely to get NHS-funded treatment. However, some regions would offer treatment if the couple do not have any children together in a current relationship, even if they've had children with previous partners. If you or your partner previously had sterilization, so either vasectomy in the male or a bilateral tubal ligation in the female, then you will not be eligible for NHS-funded treatment. In addition, if there is very low ovarian reserve in the woman, as evidenced by very low antral follicle counts, that's the number of eggs counted on scan, or abnormal hormone levels in the blood test, like low AMH, which is anti-Mullerian hormone levels, or high FSH, which is follicle stimulating hormone, then you will not be eligible for NHS-funded treatment. For modifiable criteria, next eligibility criteria is body mass index. NHS-funded treatment is available for people who are body mass index between 19 and 30 kilograms per meter square. This is usually the woman. However, there are some regions that also have a BMI cutoff for the male partner. Smoking status is another eligibility criteria, and in most areas, there's a zero tolerance for smoking. And you would actually need to provide a smoking cessation certificate to confirm that you have stopped smoking before any fertility treatment is commenced. And I know of areas where there are spot checks with carbon dioxide monitors during treatment, and if there's any suspicion that smoking is continuing during treatments can actually be cancelled or halted temporarily. Now, for those who are not eligible for NHS-funded treatment, there are other ways of trying to reduce the financial burden. One of them is the fact that quite a number of private hospitals actually offer financing as a way of paying off your treatment. In addition, there are some organizations that offer financial assistance and grants for fertility treatments, like the Fertility Network UK. Another popular means of getting the fund is crowdfunding, like using the GoFundMe pages to try and raise some money to reduce the financial burden on couples. Finally, I would say because of the high variation in various regions of the UK, my advice would be that you should do your own research when you're trying to find out whether or not you're eligible for NHS-funded treatment and what is offered in your own region. And also, if you're going private, be sure to check out the Human Fertilization and Embryology Authority website so that you have a more objective view of different private hospitals out there, what they can offer, what their ranking is, and what their success rates are. If you've enjoyed this video, please like, drop a comment, and follow for more tips.